All right, welcome back to Live at 9. It's Wellness Wednesday, and of course, we are here with Dr. Quinn. Good morning, Dr. Quinn.
Good morning.
So you see it all the time on medicine commercials with some scary side effects that may seem a little bit intimidating. But here to tell us more about that this morning is Dr. Quinn. And of course, Dr. Quinn, why should we be worried about some of these side effects that we see on commercials for medicines?
Well, you know, I get this question every day. Not just television commercials, but also social media. And what I explain to the patients, I reassure them that when we providers prescribe medication, we look at the benefits versus the risk. And if the benefits significantly outweigh the risk, then we'll prescribe the medicine if it's clinically indicated. And that's the case for a lot of medicines, but you got to think about it. I asked a patient when she drove to the clinic, did she wear a seatbelt? And she said, yes, I did. I asked her, why did you wear the seatbelt? She said, because if I have a wreck, I won't get hurt. I said, well, driving a car, a potential is the word, side effect is you can have an accident.
Right.
And any medication you take has potential risk. Anything you do has potential risk. So that's the way I described it. And she felt better about the medication.
Absolutely, Dr. Quinn. So what you're saying is just because a medicine has certain side effects does not mean that should inhibit us or stop us from taking the medication if those benefits outweigh the side effects.
Well, here's the deal. We don't want to say they have side effects. They have potential side effects. Like if you go to Walgreens and get a bottle of aspirin and look at the potential side effects, there's a list that's so long, it'll take you forever to read it. Anything, aspirin, ibuprofen, even Zyrtec has potential side effects. Any medication has potential side effects, but that word potential means that it doesn't necessarily mean that you will experience the side effects. And that's why it's so important if you take prescription medication, don't take anybody else's medicine. Take it only from your prescriber and follow up accordingly, because we assess for side effect, you know, in the history, and if they exhibit anything that makes us suspicious, then we can stop that medicine and go with a different one and make sure that that person can tolerate it.
Right. So if someone is taking a medicine and they experience one of these potential side effects, what should they do?
Let us know, because that's our job. If we don't know, then we can't really help. But at the end of the day, it's all about communication between the provider and the patient, and just that ease and comfort. And that way we can be the biggest advocate for our patients.
Of course. What would you tell one of your patients or even our viewers if they might be a little bit concerned about taking a specific medication because they heard, you know, that long list on a commercial, or they have a family member or a friend that says, well, this is a potential side effect? What would you tell someone that may be a little bit concerned about that?
Well, as I said earlier, the most important thing is communication with your provider. Your provider has your lab results, your history, your family history, and they know so much about you as an individual. And side effects, like I said, are always potential.
Right.
You might not get the side effects, but if you have that conversation with your medical doctor and the doctor prescribes medicine, but he feels that the medicine can benefit you, then, you know, I say just go with it, but make sure you keep that line of communication open. And that way you can let him know if you're experiencing any potential side effects, and then he has the opportunity to switch the medicines to something that is more tolerant by you personally as an individual.
Right. I mean, it's all about communicating with your provider, because like you said, if we experience something or a patient experiences a negative side effect, you can always change and you can modify, whether that be a dosage or a different medication. So it's really important never to just kind of believe what you see on TV or commercials or hear from other people, but just to talk with your provider is what I'm hearing for you, Dr. Quinn.
Right. I'm not saying don't believe what you see on television. It's possible. It just depends on you as an individual. Just remember, everybody is different. Like some people can eat oranges, no problem. And some people have side effects with citric fruits. It's just the medication is the same.